Hello, Dr. Mashburn again, and today's lecture is going to be about joint movements. So what we've done over the last couple of weeks is learn about our bones and then where those bones come together, where they articulate and form the joints. And so we need to understand what movements those joints do. And this is real important when we get into the muscles, because we're going to say, okay, the biceps brachii flexes the elbow. The triceps brachii extends the elbow. We're going to flex the knee. We're going to extend the knee. We're going to talk about which muscles do those movements. So we want to learn our movement angles, movement names, movement terminologies in this unit. So in your book, you have a list of all of the joints. And I am not asking you to memorize these tables, okay? So don't freak out. What I'm asking you to do is to look at these tables and to start to see patterns. And based on the patterns that you see, you should be able to, on a test, figure out, if I give you a list of joints, you should be able to figure out from that list of joints which ones flex, which ones extend, which ones do the different movements. Now, I'm going to explain that to you a little bit more in just a second, but let me go through this chart and kind of tell you how I want you to look at it. First, I want you to notice the joint names. How are they named? Well, the temporomandibular, okay? Temporal bone, mandibular bone. So that tells you that's the joint between those two bones. Well, just think about yourself. On those two bones, it's here and here. Oh, that's opening up my mouth. So we're going to learn what that is called, depression and elevation of the mandible. We're going to talk about that. Atlanto-occipital. Well, that's the joint between the occipital bone and the atlas. We talked about how one of these lets you do this and one lets you do that, right? So the atlantoaxial, the atlas and the axis, that's the pivot, okay? The atlanto-occipital, that's the up and down, the nod, right? The flex and extend. And we're going to talk about those joint movements. So just go through these and learn the names of the joints, basically that they're named on the two bones that come together. Intervertebral is the joint between the vertebra. Costovertebral is the joint between the vertebra and the ribs. And just think about what it does, okay? I'm not going to ask you if it's a synovial joint or a fibrous joint. The only structural types of joints are the ones that were in the actual joint lecture. So if I gave you a type of joint and I gave you a specific example of that type of joint, then I'll ask you that. What I want you to do now is just kind of know the movements of the different joints. All right? And it may help you to look over here and read about the type of joint. Is it a diarthrotic or amphiarthrotic? That may help you understand a little bit more about the movement. So I've put this in the PowerPoint just to give you a reference point. If you don't have your book with you as you're studying, this is in your PowerPoint for you. I've lost my pen for some reason. I'm not sure why. Hang on. There we go. And then here is the arm and the leg. So in the arm, we have the glenohumeral joint, which is the shoulder joint. So you would know that's from the glenoid fossa and the top of the head of the humerus, the proximal end of the humerus. They come together. That's your ball and socket joint. Here is your elbow, made of your proximal radio-ulnar joint. You have your distal radio-ulnar joint, your intercarpal joints. So, and again, just look at these, and if you see these joint names on a test, you can tell me which two bones are coming together to articulate at that joint. So again, look at the joint names. Most of them are named on the two bones that come together. So if I give you this on the test, you can tell me which two bones are articulating to form that joint, and you need to tell me what its movement is. Is it flexion, extension, abduction, adduction, things like that? And I'm going to explain what those terms are in just a second. So when we talk about synovial joints, they have three basic types of movements. They have gliding movements, they have angular movements, and they have rotation. Okay, so gliding is its own category. There's nothing special. I'll show you what gliding is. There's no subcategories of gliding. Angular movements, these are things where an angle is wide and then it gets narrower again. So think about your arm. Angular movements where you can flex and extend, close and open a space. And so examples of your angular movements are flexion, extension, and hyperextension, abduction, adduction, and circumduction. Those are all examples of angular movements. Rotation, you have medial and lateral rotation. So examples of your gliding movements. This was where a bone kind of slips or glides over another one. And so an example of gliding movements are at the intercarpal joints, so that's of your wrist, in your intertarsal joints inside your foot, and between your vertebrae. So this is an example of a gliding movement. So these are your carpal bones, and so intercarpal joints, so between the carpals, as you move your wrist back and forth in that waving motion, those bones just glide against each other. That's a gliding motion. Okay, it's not a wide range of motion. It's a very narrow range of motion. Now your angular movements, they're going to increase or decrease the angle between two bones. So this, if you're talking about the movement in the sagittal plane, we're talking about flexion, extension, and hyperextension. Flexion decreases the angle, extension increases the angle, and hyperextension is movement beyond anatomical position. So what does that mean? Let's look at some pictures. And you have additional pictures in your book. Okay, so of the neck, if I bend my neck down, I decrease the angle between my chin. Let me get a better color. You know, lighter color, maybe it'll show up. Well, that doesn't really show up either. If I decrease the angle between my chin and my chest, that's flexion. If I raise my head and I increase the angle between my chin and my neck, that's extension. In anatomic position, my neck is in a straight line. My head is right above my shoulders. If I lean my head back, that's hyperextension. Okay? If I bend my torso forward, I'm decreasing the angle of my torso, of my hips. That would be flexion. If I straighten back up, that's extension. If I go past anatomical position and I'll bend back, that's hyperextension. You can flex and extend the arm, the elbow, and the knee. So if you bend your knee, that's flexion. Straighten your knee is extension. If you pull your arm up like that, that's flexion. If you push your arm back to anatomical position, that's extension. If you push it further back, it's hyperextension. Okay, so each one of your joints, you need to look through your list of joints and figure out which ones are your flexors, which ones are your extensors. Now I'm going to give you a hint. The ones in this PowerPoint are not the only ones. Think about your fingers. Flexion, extension, flexion, extension. You see that? Flexion, extension. Your toes. You can flex your toes, extend your toes. You can flex your foot, extend your foot. So think about not just the ones in the picture. Go back to your chart and find all your flexors and all your extensors. Okay? Angular movements. These are movements along the frontal plane. Okay, so go back to thinking about the difference between a transverse plane, a sagittal plane, and a frontal plane, if that doesn't make sense to you. So abduction and adduction. So if you were to abduct someone, you're taking them away, right? So abduction, which sometimes you'll hear as abduction, is movement away from the midline. Adduction or adduction is movement toward the midline. Okay? So taking something away from the midline, abduction, you're abducting it away, adducting it, bringing it back. Circumduction means you're flexing, extending, abducting, and adducting all at the same time. You're making a circle in space. Okay, so let's look at a picture. So abduction, taking the arm away, adduction, bringing the arm back to midline. Same thing with your leg. You can take your leg out and bring your leg back in to the side. Circumduction is making a cone in space. Okay, so you're flexing, extending, abducting, and adducting kind of all at the same time, making a circle. Rotation is basically making turning a bone around its own axis, so toward the midline or away from it. So for example, your C1 and C2, that's rotation. You can rotate the humerus and the femur. And you're thinking, how do you do that? Well, I can take my arm, I can rotate, as you can see me, if I can rotate it out, I can rotate it in. I can take my foot and aim it out toward the outside, kind of like I'm in a ballet position with my toes pointed out, or I can put my toes in like I'm pigeon-toed and bring them back in, and that will rotate my femur, okay? So we'll show you a picture of that because you can't really see me on camera. So rotation of the head, you can see that here, okay? And then rotation of the femur. You can see where you can point your foot out and then point your foot back in, get lateral and medial rotation of the foot. There are some videos in your mastering that you can watch as well, and again, you've got this in your textbook. I tell my students to stand in front of a mirror and go through all of their joints and figure out what the movement is, okay? So you can figure out what it looks like if something medial or laterally rotates or flexes or extends. There's some other movements that we're going to talk about. Again, these will become real important when we talk about the muscles. We have supination and pronation. So if you turn your hand down to the ground, you've pronated it, and you turn your hand up and face it up, that's supination. You have dorsiflexion and plantar flexion of the foot. I'm going to show you a picture of these. Inversion and eversion of the foot, protraction and retraction, elevation and depression of the mandible, and opposition. So let's see what those look like in a picture. Again, if you go into your A&P Flicks in your study area of your book, you'll have some videos to help you understand what this looks like. So pronation is turning your hand down. I got a different color again. I need to change colors. Here you go. It's turning your hand toward the ground, and the supination is palms up. Dorsiflexion and plantar flexion. So if your plantar area of your foot is the bottom of your foot, if you flex your toe down, that's plantar flexion. The dorsal part of your foot's the top. If you flex toward the top of your foot, that's dorsiflexion, okay? Which is basically flexion and extension of the ankle, basically. But instead of saying flexion and extension, we say dorsiflexion and plantar flexion. I don't know why, we just do. Eversion and inversion of the feet. So if you turn your foot out, they're everted. If you turn your foot in, it's inverted. So I'm talking about onto the side. So if you're walking on your big toe side or on your pinky toe side, so kind of inverting and everting your feet laterally. All right, protraction and retraction. This is when you're talking about the mandible. So to jut your jaw out, that's to protract it, and to bring it back in, that's to retract your mandible. If you close your mouth, you're elevating your mandible. If you open your mouth, you're depressing your mandible. So again, when we talk about muscles, I'm going to say, okay, this muscle elevates the mandible. And you'll say, oh, that means it closes it. So it closes your mouth. So again, you want to learn these direction terms as far as the movement that that causes. You want to figure out the joint movements and how these terms describe the movement of the joint. And the last one is opposition, and this is just being able to take your thumb and touch all your fingers. We have opposable thumbs, and that means you can do this. That's opposition. All right, so I want you to get moving. So again, stand in front of a mirror, take your list of joints, do your different movements, figure out what you can flex, what you can extend, what you can rotate, what you can pivot, what you can abduct, what you can adduct, what you can circumduct. You can do that with your finger. You can make a cone in space. You can circumduct your finger. So again, look at that and figure out which joints are allowing you to do those particular movements. Again, this usually is going to be an all that apply question. The following joints will flex. The following joints will extend. The following joints will abduct. The following joints will adduct. Okay, so think of it like that. So just make you a list of flexors, extensors, abductors, circumductors, adductors, pronators, supinators, things like that, and you should be ready for the exam, okay? And this is all going to be on your lecture test. All right, I appreciate your time. Thank you.